philosophy on wellness is looking at the patient first, looking at the entire patient to try and analyze what areas are not functionally optimally. A good example would be, let's take a thyroid patient. The TSH is a most common marker that we look at. The lab range is between 0.5 and 5.0 on LabCorp. A functional range would be 1.8 to 3.0, so you can see it's much tighter. To learn if you have a thyroid problem can be a challenge. There are 11 thyroid markers that need to be done on blood work. The typical doctor will run 2, maybe 3, TSH, T4, because those are mainly the ones that they base their pharmaceutical medicines with. Okay. When we look at it, we want to see functionally what's going on with the thyroid. We want to know a lot more about it than just those 2 markers. So let's say the results come back and you have the most common thyroid problem is Hashimoto's thyroid. Hashimoto's thyroid is an autoimmune condition. It also means that you have symptoms of both hypo and hyperthyroid. In order to manage that properly, some patients may need medication, some will not. But we have to work on the autoimmune part of the thyroid problem, which is very different than the hormone part. More specifically, we have to balance out your immune system. Your immune system, it mainly has 2 sides of it, a Th1 side and a Th2 side. With autoimmune patients, that is not in a balanced relationship. Autoimmune means that the body is actually attacking itself. So we try and understand where the body is attacking itself and help to modulate the immune system to help diminish that. With Hashimoto's, typically the most common antibody attack is coming from gluten sensitivities. The body, if you eat gluten and you have a Hashimoto's problem, gluten comes in, the body treats it as a foreign invader. It will produce antibodies against the gluten, but unfortunately the gluten tissue and the thyroid tissue are very similar. So when it produces these antibodies against your gluten, it's also attacking your thyroid tissue. The next step, and once we understand you have an autoimmune Hashimoto's thyroid, so we have to again modulate your immune system, calm it down, and we have to find out what's driving it. Besides something like gluten, there are many other things that can drive an autoimmune condition. Things like a vitamin D deficiency. That's very common, so common that I wrote a book on vitamin D problems. Some of the other triggers of Hashimoto's autoimmune thyroid would be insulin surges. Blood sugar control is very important in managing thyroid conditions. Hormone imbalances. Pregnancy can be a huge trigger for Hashimoto's. We can have things like metal toxicities that can be triggers also. Environmental toxicities. The thyroid gland is one of the most sensitive glands in our body to environment. So that's why it's becoming more and more common as a problem. Weight gain is probably one of the most common symptoms of hypothyroid. The body metabolism will slow down. These patients have a tendency to eat less and less. As they eat less and less, metabolism gets slower and slower. Hypothyroid means the body is not producing enough thyroid hormones for the body to utilize. In a hyperthyroid state, it's producing too much hormones, and patients have a tendency to be hyper. They would be probably thin. They would be running around very, very quickly, maybe aberrantly. Even their eyes can actually bulge out because things are working such a high intensity. That is one of the classical signs and symptoms of Hashimoto's, having both hyper and hypo symptoms of thyroid. You may have them at the same time. One month you may be on the hyper side, another month you might be on the hypo side, third month you've got them both. So thyroid conditions, again, is a very complicated topic. And in order to work with thyroid patients, we have to get a lot of postgraduate education in order to understand the best approaches on how to handle these patients.